Hello, everybody. Welcome to our video on better aging. I am together today with Dr. Sacha Beck from the Hirslanden hospital in Switzerland. He's one of the top experts on better aging. And today I would like to talk to Dr. Beck about how to avoid cognitive decline. Good morning, Dr. Beck.
Good morning, everybody. Hello, Peter. Thank you for inviting me.
So, of course, everybody is a little afraid, I assume, on getting older and experiencing a cognitive decline. So my first question really is, and that's probably also the main question for today, how can I avoid cognitive decline when getting older?
So in the last 10 years, we had lots of studies going on, and we now really know quite well that we have several risk factors which we can influence. Risk factor that contribute about up to 30 to 40% of the risk of developing dementia.
Mm-hmm. And what are these key risk factors?
So you have to see the whole lifespan. We have different risk factors in the different lifespans. So starting with social deprivation and education in early lives, then in middle ages, starting from 30, 40 years, it's more the classical cardiovascular risk factor like smoking, hypertension, alcohol consumption, diabetes, and
stress.
Stress also, depression also, all risk factors for dementia.
Okay.
And we have also risk factors in later ages, later life, like social deprivation as well, and depression and less social activities.
So social activities, as far as I understand, and the opposite, social deprivation, you have been mentioning this 2 times. Can you go a bit more into detail why this is a potential concern?
So I talked a minute ago about the risk factors, and we have really to say that there are topics, that there are activities which really protect our brain as well. So that means that, for example, being socially or cognitively active, like be curious, do new things, talk to other people, go to theater, go to museums, all these things, they use your brain. And if the brain is getting used, the connectivity is building up, and these things are really very important. And it's never too late to start with that. Mm-hmm. So when you don't use it, you lose it.
I wanted to ask you one thing. I guess certain there is a level of decline with everybody who is getting older and older. I think we have to all face this at one point. But can you maybe somehow show what or explain what is kind of a normal decline and what is a decline that is out of the normal scope?
Yeah, that's a very important question, and it's often I often been asked in my clinic about that. So I would say it is normal that some of our cognitive function will decline getting older. So, for example, it's harder for us to get a lot of information in quite a short time. When we used to be younger and we could could fill our brains with a lot of information. But in older age, it's quite hard to get much information in short time into the memories. The one thing, and maybe the span of attention is getting a little bit shorter. We need more rest. But on the other hand, we have strategies. We have strategies to learn things, and we have our experiences. And all these things, they can compensate a little bit the areas of cognition which diminish a little bit in a normal way.
So if we're, at what point would I need to see you or a geriatric doctor? When would you tell me, Peter, I think it's time to look a bit more deeply into your cognitive decline? And then second question, what would you actually do? How can I medically say, or how can you medically say, there is something going on in your brain which is not good?
Actually, if there is fear of having something, normally we really make good experience that we have just a look on it and just discuss with each other, maybe do some neuropsychological test just to rule out. Often we just can rule out in quite a short time that there is nothing that they have to be fear of. But actually, if things getting harder, just to on a daily basis, doing things like administration, paying bills, writing mails, if everything getting longer, or if somebody else, maybe the wife or the husband or the son or daughter says, what is going on? We already discussed this yesterday. Can you not remember it? So if the surroundings gets to you and just to telling that something is maybe wrong, then you have to be aware of that there can be something which we have to look closer.
And are there any kind of MRIs that you can do of the brain, or what would you suggest to do?
Actually, in these cases, normally we just, first of all, we talk, and we really try to figure out if there are problems on a daily basis which doesn't sound well. So then on the second level, we will do some neuropsychological testing, where we have lots of experiences. We have references with the normal age groups where we can compare the results, and we will do some MRIs. And actually, diagnosing dementia still is some kind of mosaic business, which you have to really put the different information together to have the big picture if there is something, because the brain is not like a bone which is broken, so you can say, okay, there it is broken. No, it is some kind of, it's a wonderful organ, and we really have to look very closely just to get the whole picture, and then at the end we can make the diagnosis. We have some techniques to find the pathologies of Alzheimer's disease in the brain quite on an early basis. But actually, we don't yet know if everybody who has these changes really will develop dementia at the end. Mm-hmm. And
so you're saying we can see certain signs on the MRI that could point into the early stage of a dementia, but it's not 100% that once you see it, you will actually get it.
Yeah, that is exactly like this. Actually, there is a higher risk of course, when you see these changes. to develop a dementia, but not everybody will do it. And actually, at the moment, we still have not sufficient medication which just will rule back all the pathologies. So it is quite controversial at the moment to start any therapy, because the effects are not that good as we hoped that were.
But we can slow it down?
At the moment, I can only speak to Switzerland. These drugs which can clean the brain a little bit of these pathologies, they are not allowed to use because the efficacy is not that good. But I'm hopeful that we will get to a point when diagnosing these pathologies in a quite early stage, before the brain is damaged, that we really can diminish the risk or even cure the dementia, the Alzheimer dementia pathologies. Alzheimer dementia is only one type of dementia. There are different others, but I'm talking now for the Alzheimer pathologies.
Okay. So thank you, Dr. Beck. We don't want these podcasts to get too long, so I would like to stop here. Again, thank you so much for helping us out. And in the next podcast, we will talk about better aging and how you can influence better aging with a certain lifestyle. And then we will go more into depth on what to do, what kind of sports activities, maybe what kind of nutrition. So we will look and continue these podcasts then with you. Thank you so much, Dr. Beck.
Thank you, Peter. I'm looking very forward.